Welcome to Health Matters with me, Village Doctor. There is a question here that somebody asked, Nana Epia. He said, please, can you get pregnant when having sex, but always pulls the sperms out and also takes contraceptives at the same time? Please, can you get pregnant when having sex, but always pulls out the sperms and also takes the contraceptives the same time? Yes, so this method is what we call coitus interruptus. It's one of the family planning methods. When we talk about family planning or bed spacing methods, it's not only the injection and the hormones and whatever we do. There's a natural one that we call the coitus interruptus. In layman's word, it's the withdrawal method. So, as the neighbor is asking, some people think that um, during sexual intercourse or when they are having an affair, they can do the withdrawal method. So, withdrawal method or coitus interruptus is one of the methods for bed spacing or family planning. We call it coitus interruptus. So, as she's asking, can you also get pregnant? Fine. There are the advantages and disadvantages of this particular method that you are using or you are talking about. The coitus interruptus is a method of withdrawing or taking out or pulling out your penis from the vaginal orifices with the intention of not letting the semen or the sperm pour into the vagina to avoid insemination. So the main idea is one of the control methods that we use with the intention of not pouring the semen or the sperm into the vagina so that fertilization or insemination will not take place. This method is also a family planning method. People use it, but I want you to be aware of the advantages and the disadvantages of the coitus interruptus. One of the advantages of coitus interruptus or withdrawal method of family planning is people who have the objective or who have the idea to have sex or free sex, but they don't have any means, they don't have access to any contraceptive. At that moment that they want to have an affair, there is no availability or means access to any contraceptive. Then couples or partners can decide and agree to use the withdrawal method. The second disadvantage of practicing the withdrawal method is there is no monetary or direct monetary cost. You know, the withdrawal method, you don't have any direct, the word is direct monetary cost. At that moment, you're not going to incur any cost. You're not going to need any money to buy something or do something to practice this family planning method. The coitus interruptus, that's the withdrawal method. So we are saying that one of the disadvantages, there is no monetary cost. Number three, it helps you to avoid any possible adverse effect of hormonal contraceptive. Any possible adverse effect of hormonal contraceptive. You know that there is a possible adverse effect of hormonal contraceptives. So you using the withdrawal method, when partners agree to go by the withdrawal method, that's the coitus interruptus, there is no possibility of having adverse effects of any hormonal contraceptive. Point number 4 is that this practice or this method can be practiced without any prescription, without any physician's prescription, without any technical or health directives. This withdrawal method can be practiced without any prescription, without any directives from any medical practitioner. You yourself can practice this withdrawal method and practice it well without any supervision. Now let's move to the disadvantages of you practicing the withdrawal method or the coitus interruptus. One, it is less effective. The coitus interruptus or the withdrawal is less effective. The probability of you failing, the possibility of you or this method failing is very high. So we say that it's less effective. People end up getting pregnant or getting a result that they were not expecting when they practice this coitus interruptus. Point number 2, there's the risk or there's a greater chance of incurring costs that's indirectly. You see, the first one, in the advantage, you said there is no direct cost. But the disadvantage, we are saying that there is a greater chance of you incurring cost indirectly. How? If it fails, you're going to get pregnant, and the cost of pregnancy is very high. The cost of you getting pregnant and maybe the decision to abort too is very high. So we are saying that if there is a very high risk or a greater chance of you incurring debt as compared to you not incurring debt. Point number 3, it does not give us any protection from any sexually transmitted infections. Coitus interruptus doesn't provide any protection for sexually transmitted infections because there's high probability that there's something called pre-ejaculation. When the man feels that he wants to ejaculate, there has already been an ejaculation, very fast and quick one, before the person will think that the real sperms or semen are coming out. So there's possibility that the pre-ejaculation, the sperms that came very quick and faster, will get into contact with your mucous membrane, with your vagina. And if the person is infected, we know that sexually transmitted infections are mostly caused by the fluids from the partner. So there's high possibility of you getting infected. So there's no protection when you practice coitus interruptus. That's the withdrawal method. Okay, so in summary, the question that Sister Ikea asked, that can you get pregnant when you are practicing coitus interruptus, that's the withdrawal method, and at the same time on a contraceptive pill or using condom. Using condom and practicing coitus interruptus or whichever method that you're using, we call it the double up method, or we are trying to double up the way to prevent pregnancy or whatever. But I've earlier on stated that you can get STI. You can also incur indirect, debt. You can also, this method is less effective. The advantages are you don't need any consultation, medical consultation to practice this method. You don't need any health prescription to practice this withdrawal method. But when you have no access to any contraceptive available, or you don't have any contraceptive in your catch, and at that moment you want to feel or let your partner for sex or whatever, you can go in for the coitus interruptus, that's the withdrawal method. If you find this video interesting, I'll please like you to comment on this video, subscribe, click on the plus button, follow us. This is Health Matters with Village Doctor. Stay tuned. Thank you for watching.